we've had from the systematic review? Great. Over to you.
Wonderful. Thanks, Socrates. I'll try and keep this to 15 minutes so that we stick to time. And dare I say it, I think the next two presentations from Sherman and then Anne and Leah online will be some of the empirical material we've been collecting. So I think it might be of more interest to those online and in the audience. So this presentation kind of summed up by the main title here, which is essentially we did systematic literature review of the English language literature on the intersections between health, urban precarious work, and climate change, kind of extreme weather events, and the Vietnamese literature. And we were interested in trying to work out whether those literature reviews came to the same conclusions. You know, were they looking at things in the same way? Were they addressing similar sorts of issues? Were the approaches in conceptual terms the same, and so forth? So very briefly, fairly standard, we had the methodology which is outlined here. We developed the search strings, we had our inclusion and exclusion criteria, we piloted them, and then we searched, at least as far as the English language literature review is concerned, through three major databases: Scopus, Web of Science, and PubMed. And I suppose the first question, or the first challenge we had in terms of English language and Vietnamese language, was essentially, how did we find synonyms that worked across those two languages? So these are the English language search strings that we used, and here are the Vietnamese search strings that we used. And there was a kind of question about whether the words that we thought were synonyms, you know, I guess whether in practice they actually referred to exactly the same things. So that was the sort of first challenge we had in terms of setting up this comparative study. Then we used a methodology. We searched those three databases, and you can see here how we then pared our results down to, well, 734 papers in terms of across the Scopus, Web of Science, and PubMed. Then we screened them for duplicates. We then did a full text search, and we ended up with 18 papers. Second challenge was that the Vietnamese databases that we used didn't allow us the same search parameters as the English language databases. So we had to sort of adjust things to make sure that we were searching similar issues in similar ways. But that's a sort of a challenge. The Vietnamese databases weren't as flexible and as amenable to multiple level analysis than the English language databases. So this is a sort of summary of where we ended up. We ended up with 18 papers which we looked at in detail in the English language literature, and 8 papers in detail in the Vietnamese language literature. I've got a couple of sort of general points to make, and then I'll look at the differences between them. First of all, there does seem to be an assumption in the literature that somehow English language can be a mirror for all languages. So one study that looked at PubMed systematic reviews, 250 of them, found that roughly 1/3 explicitly excluded non-English articles. 1/3 didn't explicitly say that, but implicitly looking at those systematic reviews, that's what they were doing. And of the 34, so around about the third, although they didn't have a language restriction, only 80% effectively excluded non-English language sources. So it meant that round about, I think, 7% of these 250 papers actually made a conscious effort to cast their net outside the English language corpus of material. So it seems to be quite embedded in the way in which we go about these systematic evidence reviews. Second general point comes from this book, three extracts from this book, Heat a History by On Barak, Lessons from the Middle East for a Warming Planet. And I mean, maybe this is something that Dan could speak to as well later when it comes to the latter part, that he says the way that we deal in averages doesn't pick up the way in which extremes are felt by different groups in society. And I suppose a lot of the work that, for example, Locke's doing is how do older women, how do people who are migrants from rural areas, how do the individuals who are affected by flooding, extreme temperature, how do they adapt and respond and experience these kind of climatic extremes? And he calls that methodological planetarism. So the ascent of kind of reducing everything to some sort of methodological norm that can be applied across all countries. So the review. This is the table I'll be talking to. I know there's a lot of words here, but I'll kind of go through each in turn and pick out the differences. So you see I've got 4 columns. So the second column is what comes out of the English language literature. The third column, the Vietnamese language, and then a few notes. And I'll just sort of go through them. And what we're doing here, Anna and myself, is picking out, I suppose, a few takeaways. So first of all, methods. Well, across the board, most of these papers are quantitative. Some of the English language used mixed methods, but the qualitative was very much an add-on. For the Vietnamese, there was no qualitative work. So it was very much driven by a quantitative methodological approach to thinking about these issues. And I suppose it says something about what does that mean about the sort of evidence that counts in a Vietnamese context? Is qualitative evidence simply not given the time of day because of the nature of that data? And I think the presentation we'll hear from in about 20 minutes' time, Anna Le's, is one of the very first Vietnamese studies to take a qualitative approach to these sorts of questions. Secondly, weather and health. There seems to be a difference, if you like, in the way in which, health issues are very medicalized in the English language literature, and weather, if you like, is very meteorological in the English language literature as well. Whereas in the Vietnamese, and this may be a question about language, they're used in broader terms. Health, if you like, the span of health into questions of well-being seems to be much more normal in the Vietnamese literature than in the English language. And the same for climate. Climate isn't sort of pinned down in quite such a specific way. So there appear to be interesting differences in which the way in which, if you like, meteorology and health are dealt with in these literatures. And maybe that's part of this methodological planetarism that On Barak talks about in the book that I just mentioned. Then we've got causes of vulnerability. This was a bit of a surprise to us, that the English language literature spends quite a lot of time talking about the intersectionality of vulnerability, that people are vulnerable for a host of reasons. I think this is something that Mike Parker talked about actually earlier. It's not just that they're experiencing heat. It's because of the various sort of factors that cause them to be in that position in the first place. But the Vietnamese literature really wasn't looking at, it's very specific, looking at formal sector work and a discrete set of causes. So that's situating of vulnerable workers in the informal sector within wider aspects and frames of vulnerability didn't come through. So the kind of question for us here is, how do national norms in Vietnam render some groups and individuals more visible than others? And I think that speaks to Locke's presentation that we heard just before lunch. Then responsibility for adaptation. In the English language literature, the state, governments, society have an important role to play. Again, I think Mike Parker touched on this when he talked about the ethics of research. Well, where does the ethical responsibility lie? In the Vietnamese literature, it was very much on the individual. Individuals needed to change the way they behaved. what they did during periods of extreme heat, what clothes they wore, drinking water. So the onus, if you like, was put on the individual rather than on society. And that's, again, rather surprisingly, akin to this critique of neoliberal methodological individualism, which certainly framed a lot of the debate in the 80s and 90s and the early 2000s. The way in which neoliberalism leaves it to us as individuals to tackle these things. That seems to come through in the Vietnamese literature rather more so than the English language literature. And finally, so policies. Maybe this is unsurprising. The Vietnamese literature very much on short-term targeted policies that make sense and have resonance and traction in the Vietnamese context. Whereas the English language, this sort of desire always to scale up, to generalize from the particular. Whereas in the Vietnamese, there's sort of willingness to be very localized in terms of how they're treated. And maybe that says something about publishing norms. If you want to publish in an international journal, you always have to take your results into another sphere to make them speak to broader debates and contexts and experiences. So in summary, I think there are four sort of broader points here. The first one is that Anne and I think that the literature is different. So what these pair of systematic literature reviews did is show that actually we shouldn't assume that English language literature reflects literatures in other languages. There's a gap there that we need to understand. Secondly, the Vietnamese literature, much more practical, locally focused, perhaps understandably. The English language, more macro, more divorced from the reality. So it comes back to that On Barak point about the desire to be methodologically planetary in how we view things, rubbing up against the need to make things locally relevant. Third issue, Vietnamese literature, to our slight surprise, tended to overlook structural factors of vulnerability. So why are these outdoor workers undertaking this work in the first place? What are the factors that have caused them to be there? Why are migrants from rural areas forced to leave their families behind, or in a position in which they tend to leave their families behind when they come to Ho Chi Minh or Da Nang or Hanoi? How do we understand that in terms of the operation of the Vietnamese economy and indeed the global economy at a broader level? And finally, the way in which maybe publishing norms in international journals force scholars to always scale up, to generalize from the particular, to say something wider and bigger and more significant in the interests of speaking to a broader audience, and how, in that way, the specificities of the experience in individual countries maybe gets kind of lost from sight. Right. I did it. 15 minutes.
Great, yes. Jonathan, thank you. Let's stay there for 1 second. I know we don't want to. Yes, because we may have some questions. So yeah, let's try and be brief, because this was not factored in. So would you like to answer your question? It's here, somewhere.
Jonathan, but like in the UK, we do very well with local research because we have organisations which publish, the Learned Societies, the Royal Society, etc. They have publishing. In Vietnam, are there many local publishers, or are they global journals you're generally going to?
There are. I don't know if I can cunningly hand that over to Anne. Did you hear the question, Anne? Yeah. You want to come here? I think I could do this fairly, because Anne is a co-author. No, you come. I mean, in terms of handing it over to you, I'm not being unfair.
Thank you, Dan. So the question is whether in Vietnam we have Vietnam-based publisher journals. Yeah, that is a thing. So, we have a lot of umbrella association, and even the government ministries or government departments, they also some kind of they also set up their own publisher or journals. And if my work focuses on construction, I already have the construction journal under the Ministry of Construction to publish to that. So that is, I think, maybe somehow we have, most of the Vietnamese literature is published in the Vietnam-based journals. Yeah.
Thank you. Right, should we move on to the next presentation? So can I please ask Sherman Tai to take the podium? So Sherman is a senior researcher at NATS International. He has been an integral part of this research project. He has studied government and public administration at the Chinese University of Hong Kong, and then he came to London to do political sociology. His research interests are in social inequalities and collective action. And as I said, he's been one of the lead senior researchers for this project. And he will present some findings from the surveys that were conducted in Vietnam. Sherman,
thank you.
Over to you.
Thank you, Socrates, for that generous introduction. Jonathan mentioned that the dominant trend in research about climate change is quantitative. This is a perpetuation of that trend, where we talk about how are climate-related health risks unequally distributed among informal outdoor workers in urban Vietnam. Preliminary findings from our first survey. It is preliminary in the sense that it may raise more questions than answers, unfortunately, because it's the first in a series of rounds of surveys that we will conduct down the road. The point really is to raise what questions we can delve deeper and explore further in our project. This study, though this survey is a response to one of the research questions in the whole project. How do climate-related health risks map onto intersecting social vulnerabilities, such as gender, age, migrant status, and ethnicity? This can be broken down into a further few sub-research questions. So, for instance, how do social vulnerabilities exacerbate climate-related health risks? How do vulnerabilities limit workers' adaptive capacities? How do workers respond to these risks, reproduce the social vulnerabilities that they are experiencing? And it kind of is captured by the graph on the right-hand side, where you have social vulnerabilities as the predictor, and it can influence climate-related health risks in two ways, like directly exacerbates health risks experienced by workers, also indirectly through the top pathway, where it limits adaptive capacities to these health risks and therefore exacerbates the consequences. So we'll look at both pathways of influencing health risks and how do they relate to social vulnerabilities. In the survey design, we copy that graph exactly. So let's looking at it from a bigger perspective. On the left-hand side is all the different variables that we can categorize as social vulnerabilities. We got economic vulnerabilities like your income, education, home ownership, employment ones like what's your occupation, how many hours do you work every day, what's the time of work that you work, like is it under sunshine or is it hours of darkness? Cultural variables as well. What's your ethnicity and religion? Marital status, organization membership, whether you join any unions or professional associations. And in terms of citizenship as well, what's your location in Vietnam? And also what's your residency status there? Do you have a long-term permit? Do you have a permanent residency permit? Or you're a migrant undocumented worker? Also demographic vulnerabilities such as your gender, age, and any underlying medical conditions. And we're seeing how all of these variables influence the orange box, the health risk, either directly or indirectly through the purple, adaptive capacity as well. And we sort of conceptualize health risk in two ways. The first is perceptions, your self-rated impact of climate change on health. So we ask workers to rate how big an impact has climate change had on on your health, and also objectively through health problems that they are experiencing. We also ask workers what kind of physical and mental health problems do they experience because of extreme weather. So that's the direct pathway. The indirect pathway is through adaptive capacities, and it's also rated or conceptualized through two aspects. Perceptions as well. We ask workers to rate the difficulty in coping with extreme weather, their ability to adapt to climate change, and also objective measurements like the resources that they can mobilize to respond to health risks. For instance, medical insurance and digital literacy, as in what kind of sources do you rely on climate change information? Do you own a smartphone? Do you use a smartphone? Or do you face any difficulties using a smartphone? We do, our local partner, Social Life, conducted the first in a series of surveys with over 400 informal workers. The data is collected from May to June in 2024. The second survey, that's starting in March, will target 1,200 respondents. We do put a quota on the number of people we survey. We have 100 workers in each city and then 100 workers in each occupation that is targeted by this study. We're not able to use probability sampling because, as Locke has mentioned in his presentation, workers are not on an official registration list. We can't go and have a list of informal outdoor workers and go like, every 5 workers will call them for a survey. We can't really do that. We rely on Social Life's civil society networks to contact these workers through our informal relationships. And therefore, unfortunately, the sampling won't be representative of the entire population of informal outdoor workers, because we also don't know the total population of informal outdoor workers in Vietnam. But this represents a rare attempt to use quantitative methods, surveys, to contact all these workers who are often highly mobile, hard to reach, and therefore often neglected in existing studies, as Jonathan has mentioned. So who responded to our survey? Most of them, 91% of them, are kin, ethnic majority. 73% of them are male. 52% are not permanent residents in the city. They are either on a temporary permit or a migrant worker. The mean age of all 400 respondents is 47 years old, and the mean monthly income is 240 pounds, which is about 7.5 million in Vietnam dong. We analyzed all this data using regression with the help of N and Alpha online in Vietnam. We ran 13 models using logistic and linear regression. We checked all the model assumptions to make sure that models are valid and the results are okay. We assume that the observations are independent and there are no interactions between predictors. And all this analysis enables us to explore statistically significant associations within the respondents that we surveyed and estimate a specific percentage change in the outcome probability. So for instance, when your education level goes from college to university, how much does that change your percentage of experiencing health risk, for example? So we have a host of predictors or independent variables, and we will look at how these variables influence the 3 things: health risk, adaptive capacities, and reproduction of their social vulnerabilities. I think one of these variables should be quite self-evident, or like even outrageously self-evident, which is that health risk causes health risk, as in underlying medical conditions exacerbate both physical and mental health risk related to extreme weather. We found that people who have existing medical conditions who are already a patient, they experience much more physical and mental health risk that is directly related to extreme weather. It increases 13% more probability that workers with underlying conditions are going to report that they believe climate change had much impact.
Lines.
We can see the slide.
Oh, yeah, thank you.
Can people online hear us? Yes.
Okay.
Okay.
And then can they hear the presenters online? Can you start that? We call everyone back. Call everyone back ASAP.
Just so you're gonna use my laptop. Oh, we will use my laptop. Can you check the chat?
Is there any colleague outside? Can you come inside, please?
See?
You start editing and conducting your own report. Okay. We're back to business. Right, so, would like to thank Sherman again. Thank you very much, Sherman. Very interesting presentation. And hopefully our colleagues, our online colleagues can hear us. So this is going to be the last presentation from this particular session with preliminary data. And we have two researchers, Bo and Le Nguyen from Vietnam. Anne is a researcher at the Social Life Research Institute. She is involved in a study examining the health impacts of climate change on this study, basically. Anne's research interests include theories of welfare state, models, social mobility, with a particular focus on intergenerational mobility within Vietnam. Le is also a researcher at Social Life Research Institute, where she coordinates the Life Story Lab. Her research interests include gender, migration studies, and community development. Now, but as we've heard before from Jonathan, apparently there are no qualitative studies in Vietnam that we have come across. So this, I guess, is going to be the first of its kind. So thank you very much. We are ready when you are to start.
Yeah, thank you very much. So, thank you very much for introduce us. Can you hear me
Thank you very much. Thank you. You may start.
clearly?
We can hear you fine. Yeah, thank you.
Yeah, okay, I will start. So thank you so much for introducing us. And now my colleague Le and I will present our qualitative report titled Sun Rain Does No Problem. So what is it? This report presents the qualitative findings which explore health and livelihood safety adaptation strategies of Vietnamese urban precarious outdoor workers, highlighting their resilience and coping mechanisms in harsh conditions in the context of climate change. And as Jonathan said, this might be the first work in Vietnam using qualitative methods for this topic. And our presentation will go through 6 sections from research questions to key takeaways, as you may see on the slides. So in terms of research questions, we will address 3 following research questions. The first one is the underlying reasons behind workers' decisions to participate in the precarious outdoor labor market. And the second is where health concerns related to climate change stand among the priorities of outdoor workers. And the third one is their coping mechanisms for climate change. And to answer the research questions, we choose to analyze the findings through the lens of James Gould's moral economy theory, as you can read on the slide. This theory contains a principle named safety principle. That means the subsistence farmers prioritize economic security over profit, and they will eschew any opportunities that even slightly increase the chance of falling below the subsistence line. And one thing to note is that the definition of safety here is livelihood safety. That means keeping the livelihood not falling below the subsistence line, not related to health or crimes or other security concerns. And why we choose this theory for our report, the reason is that like Scots peasants, Vietnamese urban precarious outdoor workers have very low income and often lack formal protection and depend on informal networks and social norms to survive. And viewing their choices through the lens of moral economy helps explain how they navigate health risks and economic pressures and help design social policies that address their real needs. And to collect the data for our findings, we, next slide, please, Lei. We carry out a few works, in-app interviews and focus group discussion with precarious outdoor workers who had joined our survey before. And there are some others beyond the survey, but have the same scope of work and connection with the ones we conducted the survey with. And now Lei will continue to share our key findings.
Thank you, Anne, for such a comprehensive introduction. If you remind, we turn off my camera because I share my screen because my internet connection is like unstable. So I will turn the camera back on during Q&A section. So hello everyone, I'm Lei and I would like to share our research findings. We have identified 3 key points in here. Firstly, the reason why other workers choose independent work. Secondly, we explore the complex trade-off between livelihood and safety in their work. Thirdly, I will talk about the way that other workers choose to deal with their health issues and indicate a phenomenon where health risks are often downplayed and workers develop their own adaptive strategies. So firstly, I'd like to highlight why workers in our research choose independent work. Our findings revealed 4 key reasons. At the passive cost, as you can see in the screen, we discovered that outdoor workers are ineligible for formal sector employment. And as for proactive factors, we identified 3 reasons here, including the continuing rural practices in urban settings, women's family care responsibilities, and dignity preservation for older adults. So for the first reason, other workers are not eligible for the formal labor sector. So our research indicates that individuals often choose outdoor work as a last resort due to a lack of skill and opportunities for other careers. Furthermore, they do not show any intention to change their circumstance. And second, they bring their rural habits to the city. Familiar with self-employment in agriculture, they're used to working for themselves, so they find it hard to deal with strict workplace rules. They prefer having autonomy and flexibility over following strict schedules, and they also stick to their community networks and heard story about how unstable and strict casual work can be. So they choose self-employed work and save for their own work equipment for the future. And furthermore, during our in-depth interview, a male elderly vendor revealed that they must take up the entire final month of the year to return to their hometown to attend family or community ceremonial occasions, such as death anniversaries or weddings, so on. So in Vietnam, as an elderly member of family and community, their absence from such occasions could be unacceptable. So this isn't merely about attending ceremonies, it's about maintaining their role and status within the community. So a formal job would not allow them for such extended leave. Therefore, independent work becomes a suitable choice, allowing them to flexibly arrange their time and fulfill their important social cultural responsibility. And for the third reason, from a gender perspective, for women outdoor workers, independent work isn't simply tied to work autonomy as is for men, but rather relates to their ability to balance income earning with family care responsibility. So our interviews show that they prioritize work that offers temporal and spatial responsibility, led them to fulfill their childcare roles in the family. So this serves as a compelling evidence of a double burden that Vietnamese women face in Vietnam society nowadays. So the final reason is that many elderly individuals want to maintain their independence to preserve their dignity. So they often feel uncomfortable relying on their children for financial support. Take an elderly woman who sells beverage outside the Ho Chi Minh City wholesale markets, like an example. She's over 70 years old, but continues to work hard because she does not want to burden her daughter, who is already busy raising her own children. And another example is an elderly male driver who refused to accept money from his children. He emphasized that it's a matter of dignity as a father. He wants his children to respect him by being self-sufficient. So this illustrates how many Vietnamese people view financial independence as crucial to maintaining their status and dignity within the family, especially as they're getting older. So autonomy and safety are often viewed as opposing values in workers' livelihood strategies. While safety ensures stability and predictability for the future, autonomy opens up space for flexibility, but comes with higher risks. For urban outdoor workers, this trade-off becomes even more complex and they prioritize livelihood security, like employment and income, over health security, like health conditions and labor environment. So in their view, safety means securing their income. Occupational health and safety concern always take a back seat. So I would like to move on to the second finding, health safety second, livelihood over health concern. So in light of increasingly frequent and erratic weather patterns in Vietnam, all laborers across different sectors have become vulnerable and face serious challenges in maintaining their livelihoods. So take an example of Cư Minh, for whom we have more stories about their experiences under changing climate conditions. Because they have to balance income earning, childcare responsibility, and health protection under increasingly harsh weather conditions, that placing them far more vulnerable than males. So physiologically, women typically have lower physical endurance than men in conditions of high temperature and humidity. Given the nature of their work, they often work continuously for many hours under direct weather exposure without proper shelter or adequate rest facilities. So the situation becomes particularly challenging when they must bring their children to their workplace, creating an additional burden of protecting both their own and their children's health under severe weather conditions. So despite the health risk associated with the poor working conditions, many outdoor workers prioritize their income over health concerns. So the normalization of health risk were clearly evidenced in our focus group discussion. One construction worker said that working outdoors means you must endure the sun, rain, and dust, right? There's no problem. If one saw any problem, they couldn't have chosen this job. A woman street vendor in Ho Chi Minh City who ignored her sun-induced skin allergies, letting them heal themselves instead of seeking medical solutions. So for workers who are the breadwinner for the families, healthcare often take a back seat to livelihood. So they continue working as long as they believe that they're still healthy enough. So this attitude may reflect a concerning reality about precarious workers' access to healthcare services. So financial barriers are the primary factor preventing them from engaging in healthcare services. So even at its most basic level, as you can see in the screen, the cost of a general health checkup remains a significant burden for those with precarious incomes. And not just for the financial issues, the health risk normalization mindset can be seen as a psychological coping mechanism that enables them to maintain their work under harsh conditions. By accepting these risks as an inherent part of their occupation, they create kind of psychological defense to reduce anxiety and stress during their work. And from second finding, you can see that outdoor workers typically minimize health concerns, believing that they are fine. So these help lead to various protective practices in their outdoor work environment. So I would like to move to the third finding, a coping mechanism for climate change. So as I have mentioned in previous findings, other workers in Vietnam continue to work regardless of extreme weather conditions like sun or rain. And they have diverse adaptive equipment, like they have hat, gloves, sun protective clothing, and they practice drinking more water, resting more regularly, or using traditional medicine to cope with climate change. So I would like to show you some pictures from our fieldwork. Our research team in Hanoi and Ho Chi Minh City sat under the bridge with our workers here. The bridges serve as a perfect rest spot, providing shelter from rain and shade on sunny days for our workers. And the picture demonstrated how labor rests in the shade of the tree. At the picture, this is the motorbike rider, and at the picture, this is our research team, and this is our workers that we started beneath a tree during this focus group discussion at the wholesale market in Ho Chi Minh City. As you can see in here in the yellow circle, this is a tree that planted by local residents to provide shelter for residents and for outdoor workers in this area. So a significant challenge we observed is that numerous informal workers either cannot afford voluntary health insurance or do not consider it a priority to assess hospital health screening. They end up looking for a cheaper option instead. So many other workers turn to Eastern medicine because it's affordable and easy to find, right? But to be clear, we're not questioning the efficacy of Eastern medicine. Rather, our concern lies with that these workers often resorting to self-treatment instead of consulting qualified medical practitioners. And how do workers typically seek information about health issues? They often turn to their friends and family for advice, rely on traditional knowledge, or use social media platforms like YouTube, Facebook, or TikTok for health guidance. These sources are appealing to them because they are free and easy to understand and relevant to their daily life. So this is interesting because it highlights two key issues in here. The first, outdoor workers are capable of using smartphones to access information, health information. But second, this also presents risks as they may encounter much unreliable and unverified information. So this all the finding from our research. Now I would like to leave the floor to Anne for further discussion. Anne, it's over to you.
Oh, yeah, thank you, Lei. So from the findings, we have some viewpoints to discuss through the lens of moral economy. I try to talk quickly. So first of all, according to Scott's concept of the subsistence ethic, subsistence isn't just about material needs, but it's also a moral standard valued by the community, and threatening the subsistence rights not only disrupt peasants' basic needs, but also the moral order that possibly triggering resistance. So like the Scots peasants, our participants, our workers, struggle every day for their livelihood, and therefore policy for this group should respect the subsistence ethics and avoid conditions that undermine their basic needs. For example, healthcare policy should provide microinsurance to ensure that workers still have income on sick days, similar to former workers' benefits, so that they can both protect their health and maintain their daily subsistence. And in addition, we must also pay attention to their deeply human needs, which can be seen as new form of their safety. These include self-determination, dignity, responsibility to family, as they presented in the key finding section. And in doing so, we must avoid victimizing them as miserable individuals, but seeing them as individuals with their own aspirations and the right to make decisions about their lives, such as including their voices in policy-making process. And in general, these are some key takeaways from our presentation. In terms of findings, so first one, Vietnamese urban precarious outdoor workers may have different job paths, but they all prioritize securing their basic livelihood and almost can't afford to stop working, no matter the difficulties caused by climate change. And secondly, beyond the subsistence, they still aspire to self-determination, dignity, and so on. And thirdly, when facing challenges, they rely on low-cost solutions, and none of the participants in our research mentioned government or civil societies in protecting their health. And finally, to support outdoor workers' health in urban Vietnam, the policy should take care of their subsistence by understanding their basic needs and ensuring that welfare policy respect their subsistence. Furthermore, it's also crucial to expand moral standards in the economy by considering their other human needs when constructing their welfare policies. And last but not least, we shouldn't enforce any rules or conditions that violate their fundamental needs for securing their livelihoods. And we should avoid seeing elder workers as helpless individuals because they have other humanistic demands beyond the subsistence in life. And once we well implemented these ideas, we can increase the possibility that workers can benefit from welfare policy suiting their needs and context. And that's all of our presentation. Thank you for listening.
Thank you. I'm for the fascinating presentation. It's a real privilege to hear the findings of what might actually be the first qualitative study on the topic in Vietnam. Socrates, who was sitting here before, he with his apologies, he has to leave for another commitment. So I'm going to take over. For those of you who haven't met me yet, my name is Jennifer Egger. I am a colleague of Anne and the other members of the NASDAQ team here. I'm research director in the organization. We are a bit behind schedule because of the technical difficulties that we encountered. We try to catch up a little bit, but we might also just stay a bit longer. That's okay, and of course, don't feel like you need to stay. So we have some time for questions, answers, comments now. Yeah, there's one here in the back. Is there a microphone?
Thank you. So I think this probably addresses all the presentations in different sorts of extents. I mean, any short answers are great. I have two sorts of questions. So the one is about the terminology here, and whether we're talking about exactly the same things and whether that matters. So we've got, on the one hand, kind of a group of concepts here around the nature of the work. So we've got precarious, informal, we also have independent work as a description there. And I did wonder if those things are coextensive, whether they're not, whether that matters for the project. I think similarly, there's a question over exposure to climate change risks versus impacted by climate change versus impacted by extreme weather that might, again, kind of wonder to what extent that needs unpicking. The second question was about the role of the app here. I guess thinking back to Jonathan's comments earlier on about the way in which Vietnamese English and literatures kind of perceive the nature of the question. I wondered if, well, depending on what kind of, so I think the I in the app stands for information, is that right? So the question then is what kind of information is on the app? Because there's presumably a version of that which is about kind of informing people of the kind of weather that might pose hazards. And so that seems to kind of reinforce or speak very much to that kind of personal responsibility conception where you give people the information in which they can make their own choices or kind of consent or not consent to the work they're going to do. There's a different version of the app which I guess speaks to this kind of slide on key takeaways and says the information that's needed is information on entitlements, on how to self-organise to effective representation in policy making, and that speaks to a very different conception of kind of how this kind of question should be tackled. So, I mean, any thoughts on kind of how the findings so far feed into what the role of the app is, what information should be on it, and kind of what conception it's reinforcing? I think would be interesting as well.
Okay, great. Thank you so much. So two questions, one around terminology, and the other about the app, the role of the app, how the findings feed into that. We have 5 speakers, so I have to leave it to you to decide who would like to speak to which of the questions.
Yeah, we've got a presentation about the app about to come up. So whether we leave it for that and then the presentation regarding the app, but I think that's important. In terms of becoming conceptual phrasing, I suppose at a broad level, and I'm to paraphrase Jesse Revo, that if you have vulnerability to climate change doesn't fall from the sky, yeah, that it's situated within a whole range of other exclusions and marginalizations, which have always been a feature, not just of Vietnam, but of just about any place we care to look at. So the only question is, how does the intersection, how does this nexus between climate change, health, and outdoor work, how does it get reproduced given those histories of marginalization? So rural urban migrants who maybe are registered in rural areas, leaving their families behind, who are obliged, given the kind of moral norms, to feed money back to neighbourhood villages and households. How do those get amplified, or how do they get reproduced by the conditions of climate change? So I suppose that's the sort of broader sort of framing of the study. I mean, the precarity question, I mean, obviously comes out of, well, comes out of Guy Sandy's work on the precariat. So how does late capitalism create a class of workers who are, don't have guarantees? Now, of course, whether that works in a place like Vietnam, I mean, it came out of the European experience. So how do we translate that into Vietnam? I mean, I think there are precarious workers. Maybe they've always been precarious, but I think they may be precarious differently now than they were, say, in a rural context. So when James Scott was writing his Moral Economy of the Peasant, was in 1976, he, of course, was trying to dig into the traditions, the subsistence ethic, which predated modern commercial life. And we're asking questions about, well, how does that still get perpetuated in a condition of late capitalism? So we're seeing that being threaded through. Probably don't want too long tonight. But anyway, I don't know if Anne and Lei have, whether they're still online. Yes, they are. Whether you would like to respond to that question.
Sorry, we cannot hear you well. Can you repeat it again, please?
Or German, for that matter. We hear now or not?
Sorry, just
Oh, yes.
you hear me? You hear me? Do you hear me?
Yeah.
But sorry, but because like it's something with the sound that we cannot hear you well.
Yes,
So
we can hear you. Can you hear us, Lei? Can you hear us at all?
The speaker is a bit far, so it's difficult to hear online.
Can you hear us from this microphone?
Oh, yes, I can hear you, but maybe there's problem with Lei. Let me take her.
When you answer the question, is it properly?
Yeah. Hi, Lei, can you hear us?
I can hear you.
Did you hear the question earlier?
But sorry, but can you just wrap up your questions? Because I couldn't hear you clearly before.
You want to ask the question again?
You want to ask again?
Maybe I can.
This one is working?
Sorry, what should I do? Can someone come here?
Let me just try and the question really, I'll try it as clearly as I can. So is there a difference between independent work, precarious work and informal work? And is that a difference that matters for the project?
Oh, yeah, okay. I understand your questions. So, maybe in the presentation of Dr. Locke before, I was not sure if he explained this definition or not, but in our research, we just focused on the precarious outdoor worker who do the informal job, including street vending, constructing without any construct with the employers. And among the large group of informal works, we just choose the one who have very low income. They may have less than 3 million Vietnam dong. Maybe that's less than I'm not sure about the UK pound, but less than sorry. So I mean that they have very low income and they struggle every day with the subsistence as I explained before, and those are our target participants in our research.
Thank you.
Okay, great, thank you. Do we have another question for speakers? Okay, I mean, I think it's been a long day and perhaps we have reached the afternoon, which is fine. So maybe in the interest of time, because we're really good, we just move on. So the journey person thinking of the speakers again, and yeah, and then I will hand over to Anne for panorama.
Thank you, Jenny, for this really great. I think now we move to the session where we introduce the app. And one of team members from Social Life will dine online to present the app. Can people online hear us? Okay, I guess so. So may I introduce Lam Nguyen? She's a lecturer at the University of Social Sciences and Humanities at the Vietnam National University, Ho Chi Minh City. And she has been teaching and specializes in the applications of GIS and remote sensing within social sciences and urban planning. Now, Lan, I think that you can share the screen now. Unmute.
Yeah. No, she should. We can do it.
Yeah, can you hear me?
Yeah. Yeah,
Yeah,
can you hear us?
Yeah, we can hear you now.
Yeah, thank you. I will share my screen. Yeah, can you see my screen?
Yeah, we can see it.
Yes, we can see.
Yeah, thank you. Thank you, Dr. An, for introducing me to this event. And I'm going to talk about the Intelligent Climate Alert Network for Outdoor Workers. In shortly, we can call it ICANN. This is the early weather risk warning application. And this app is a non-profit app. It is designed for the outdoor workers under the Wellcome Trust funding project that we are having this lunch event today. And this is among the keys of this project. And hereafter, I will call the ICANN for the short of the application name. And with a short word, the main message we send through this is that outdoor workers have the ability to proactively protect their health against the climate change, and they can increase their awareness about climate change as well as the health risk and other information. My presentation has for content including the approach to designing ICANN app and how ICANN has been developed and tested over the past years. And the third is that some key features that make ICANN differ from other mobile app. And the last one is the key takeaway from the ICANN development. Yeah. In this slides, I will share about the approach to designing ICANN apps. Firstly, is as recommended by the IPCC, and the health-related risk is defined in this project is the result from dynamic interaction between climate-related hazards and their exposures, the outdoors exposure and vulnerability to the hazards. And the finding from the previous presentation, you can see that the outdoor workers in Vietnam are exposed to intense heat during peak hours. We can easily lead them to heat-related and other health problems. Besides, outdoor workers are the most vulnerable population, and they are often neglected in policy decisions. Therefore, developing an app to locate shelter points water sources, weather warning, and safety guidance is necessary for the outdoor workers in Vietnam nowadays. The second is that the second principle that we use to approach in the designing ICANN app is that we clearly identify that this app should provide integrated information about the weather conditions and health-related warning. And this app also delivered personalized guidance data rather than one-size-fits-all solution as other existing apps do. So we realize that the most we come to the result. The conclusion is that because we do some review of the existing mobile app, the most popular app in Vietnam, we realize that these apps only focus on the weather conditions, are only focus on the guides for people, for mass people, training for their health, but they did not integrate these information in the only one apps. And the second is that, and the third is that we use the approach with the worker, the outdoor workers can be considered as the co-constructors because they're not information provider. They also the one who set the app designs and development process. And the last principle is that when we design this app, we get the consensus from many stakeholders from various fields in order to get the verified information. And these consenters involved in the designing the process include the representatives of the city government, from the labor association, and the Ho Chi Minh City's Centers for Disease Control, and other researchers in psychology, environment, and the healthcare for publics. And during the development process, the ICANN app will be designed based on the principles is that the user-centric design. This is the cornerstone when you get involved, the workers or the users to the app design and implementation. Because by aligning the app designs with the user needs and expectation, developers our teams can cultivate strong user satisfaction and loyalties, and then the driving engagement from the outdoor worker to use the app after that. And the second principle is that the designing process will be the interactive design. Because this is the process where designers continuously improve the product through repeated cycles of testing and refining. This method involves creating a basic version of the products, testing with the users, like the outdoor worker in this project, gathering the feedback and making the necessary improvement. And we use within the internal testing, city feedbacks on the user experience and the app interface were gathered, resulting in the friendly version that is ready to publish to the outdoor workers. And the third principle is that we use the verified and freely accessible information sources because as stated before in the Lê and Ang presentation, the outdoor worker can access to the variables of information sources, but this sources is unreliable and unverified, so that this app can should provide verified information from the authenticated sources. Yes. And the last principles for developing the ICANN app is to form, we're looking for to forming a living platform where the community can exploit and they all create the data based on their needs and expectation. And here's some activity with the photo when we design the app to get involved to of the outdoor workers. In this photo, you can see that we discuss with the worker at each city, at each mega city, and we get the feedback of the worker. How to design at the beginning of this process. And the second one is that after we finish the initial version, we talk to the outdoor workers, and we ask them to together test with their daily routines to make the clarified information provided by the apps. And the feedback from the outdoor workers collected through casual conversation. And this activity will help identify the critical weather warnings and to identify the need to improvement for the app the ICANN app. And now, some insights we can derive some after communicated with the outdoor workers. The first one is that the worker appreciated being part of the development process of the ICANN apps. And the medical facility mapping emerged from the community suggestion. The language and interface simplified based on the daily feedback from the outdoor worker, and the developer teams will make it in the reality. And the last one is that the data usage concerns addressed to the problem solving, especially the how to use the ICANN map and how to rely on this data to get the warning and to get the notification. And some feature that's driven from the communities. This is the offline mode requested by the motorcycle taxi drivers because the Wi-Fi or the internet is not available for everywhere in Ho Chi Minh cities or also in the other urban areas. And the voice alert suggested by the elderly street vendors because of their struggle to hear information about from the mobile phone. And the emergencies context added after community discussion. And the last is that support forum created to maintain worker connection. Because throughout this project, we try to make the good relationship with the communities from the other workers. And to form a living platform, for the communities. We want to build a sustainable community network, and the worker will introduce up-to-date social circles. This is the best way to enlarge the number of the users of the ICANN map. And the labor unions and also association promoting through existing relationship. And the communities health center incorporating apps into worker support by providing healthcare information. And this app regular gathering the weather experience user mental news user. And this is the activity what we continues this year. And after on the post testing app revision, the first is that the interface improvement, and then the next one is that the new feature added for the updated version. For example, offline mode for the basic function, the voice alert, the community support forum on emergency contact quick dial, and our ongoing initiative is free training and distribution information materials for the worker at the Garden Bond. Yeah, and now this app is available on Android and iOS. Remember that this is a non-profit initiative to support our worker communities, and you can get download this app through the QR in this slide. And here are some key features that make ICANN apps differ from the other application. And you can see that beside the general function, the ICANN app can provide weather condition, can provide utility maps which show the location of facilities such as hospitals and medical facility. Some interesting point that created by the worker. And the first is, the last one is that the knowledge sharing to improve the awareness of the worker about the policy, the laws, some rights suitable for their precarious work. But the recommendation is that this app is not a substitute for professional medical advice. So the user, the worker, can consent to the doctor before making any health-related decision. Yeah. For the features of weather condition map, you can see here the lines is that the map show the condition at the areas of Ho Chi Minh City. In the right hand, you can see, in the right hand, you can see the layer list that consists of the current weather condition, including the heat index, the temperature, the ambient temperature, and the wind. The app also provides the information from the satellite imagery to show the top clouds at the area that shows in the map. And in the left hand, you can see the symbologies of the point, the polygon shown in the map. You can see that this is the symbology of heat field like. It's different from the ambient temperature, because the heat field light is the compositions of the temperature, the humidity, and the wind that make people feel hotter or colder than they can identify from the temperatures. And this is the map we can This is the interactive map. The workers or the users can click directly in the maps, and the pop-ups appear to provide more detail. That is recorded at the weather station. And you can see here that the difference between the temperatures, the ambient temperatures and the temperature that people can feel like. Yeah. So with the features of weather condition map, this app displays and focuses the weather information at the worker location or positions, such as temperatures, humidities, air qualities. And this app can explain in detail the weather hazards. You can see it's at the picture, it's in the right hand. This is the explanations about the air quality index, which is can harm the workers' health. And this feature can display the related health alert, such as high temperature that could lead to heat stroke, air pollution, potential health risk based on the current conditions, based on the current physical condition of the outdoor worker. And the next one is that the utility map. In this picture, you can see that the utility provided by the app can be first for the vegetation covers from the areas. You can see the green zones indicates the vegetation cover, and the darker greens is the higher canopies of the vegetation here. So from this information, when the outdoor worker feel heat, they can find a way to sit or to stand under the shadow of the tree. And the second facilities provided from this app is that the interest point created by the community, by the outdoor worker, and the points with the red label created by the local partner. And this is the in this feature, you can see that this is the free street side iced tea, where the outdoor worker can reach to drink the water freely. Yeah, and the last one is that the facility provided by the ICANN app is the hospital and medical center, which is near to the worker's position. And when the worker position want to find the nearest facility or the nearest center, they can this app can provide the directions to this to the nearest one.
Amina, I'm so sorry, but we have to stop the presentation. Can you just wrap up very quickly? We have to move on. Time is over, unfortunately.
Yeah, thank you for your reminder. And this is the third features from the for the first as for the outdoor worker. And now the three key takeaways from the ICANN development is that the first ICANN is committed to provide support tool and platform to outdoor workers to cope with the extreme weather conditions caused by the climate change. And the ICANN have outdoor workers identify potential weather hazards, protect their health through disease information and further guidance, and increase their knowledge of other issues helpful for their precarious work. And the last one is that although developing ICANN app is more time consuming than developing other apps, but it's worth doing because it's closely engaged with the outdoor workers and highly tailored to their needs. And thank you for your listening.
Thank you so much, Milan.
Everyone, welcome back. This is the final session, home run, before the reception. We've got an hour to kind of think about what does this all mean for policy, and what we're going to start with is a 20-minute keynote from Fortunate Machungura, and we've got, thanks Fortunate, we can see your slides, and then when that's finished, I'll see if there are any kind of questions in connection with Fortunate's presentation, just maybe 5 minutes. And then we'll have 40 minutes for a more of a roundtable panel discussion. So Dan Mitchell will come to the front, Anne will come, Locke as well. So 3 in person, and then Fortunate and Dorothy Ngajilo, who works for the WHO, is going to join us online. So there's lots of scope for this to go wrong. We've got 3 in person, 2 online, but we're going to start with Fortunate. So I'll just introduce Fortunate, and then I'll introduce Dorothy after Fortunate's presentation. Fortunate Machungura is the chairperson of the first Climate and Health Africa conference, which is designed to foster connections between academia and policy interests at the intersection of climate and health in Africa. So that speaks directly to this panel. She's a social anthropologist focusing on climate health and policy, and lectures in the Department of International Public Health at the Liverpool School of Tropical Medicine. And she also leads the Climate, Environment and Health Department at the Center for Sexual Health and HIV/AIDS Research in Zimbabwe. Welcome, Fortunate. So you have 20 minutes. We look forward to listening to you.
Thank you so much for that very warm introduction. I'm just not sure if you can see my slides at the moment, or should I try again?
Do you want to put them on? We can see them on display mode.
Okay, let me see.
Yes.
Can you, is that what you're still seeing?
Yeah, no, we can see them now. They're slightly large, too large for the screen, but that's fine. So we can see them now. So continue, and we can hear you just fine.
Okay, that's great. If anything, just let me know, and then I'll try to tweak. So good afternoon, and again, thank you for the opportunity to speak on bridging the academic policy divide around climate change and health in Africa. My name is Fortunate, and I'm based in Zimbabwe, and I had the honor and privilege to chair the first International Climate and Health Africa Conference, which was convened in 2024. I'm very passionate about discussions and hopefully addressing the complexities that exist between research, policy, and practice. So I'm very honored to be here today. So I will just start by talking about what we do at SESHA. And this framework tries to summarize some of our work. We are mostly looking at managing heat-related risks for the health workforce, both facility-based healthcare workers and outdoor community-based healthcare workers. Africa is still largely 60% rural, and health infrastructure is still scarce. And therefore, the outdoor community health worker is important, but also focusing on maternal, neonatal, and child health in rural Zimbabwe. We collaborate mostly with South Africa, and most of our work in South Africa is urban focused. But for most of the examples that I've provided in this presentation, I'm going to give examples from a rural perspective where the majority African still resides. And our work tries to integrate the biology, pathophysiological mechanisms with the epidemiology, intervention, design, including work on the design and implementation of early warning systems, and then think about feasibility and scaling of these interventions. And we do this in collaboration with academics, governmental and international stakeholders. So the discussions earlier on co-creation, co-production, and co-design resonate with some of the work that we do.
Have you moved on to the have you moved on to the next slide, Fortunate? We've still got your title slide.
Oh, yes, I did. I'm
right.
actually seeing my second slide from my end.
Okay. We're still on your title slide. I don't know what's happening there. What was to
So Jonathan, if okay, I sent you these slides. If all right, if you could share from your end.
Okay, we'll just see. Can we do that? No, we can't. Apparently, I'm just looking at the technicians. Apparently, we can't.
Hey, let me try
what if
again.
you go onto your yes, try again.
Okay,
Sorry about this.
no worries.
Are you loading it up again, Fortunate?
Yeah.
Yes.
Can you see the slides?
Yeah, we can see right now. If you just move forward, that's kind of gone weird. Right, that's not. We can't. What have you?
Let me use one screen. I'm using two screens, so it's probably.
Oh, I see. That's probably it. So we've just see your title slide. What have you click on now? Right. That looks good. We can see the whole slide now. What have you go forward now? Yes, perfect. Yeah. That's it. Oh, yes, that's it. Oh.
Can you?
Gosh, it's exciting. Yes, that's good. I'm not sure if you're moving between the two screens, Fortunate. Is that creating a problem?
Yeah. It's just duplicate my slides, so then I can't see from my end
Right.
where the next slide is. Let me see if I can swap displays.
Okay. So we've just got the title slide at the moment.
Are they double now?
Yeah, one is sort of superimposed on the other. That's so well, yes, we could probably live with that if you can go forward.
Okay.
Can you go forward on that one? To the next slide?
Can
yes.
you see?
Yep, yep.
Okay.
I think that's great. Okay.
Okay, how problematic is it in terms from how you're seeing? Is it too bad?
No, it's fine. It's slightly smaller than before, but we can
in this? Is this
that's larger, yes. Okay.
Sorry about that.
No worries.
Okay.
So
are you seeing the one that's talking about current emphasis?
That's right.
All right. I'm just gonna
focus.
Yeah, I'll jump that one. This is just basically, giving a summary of the current exposures that we focus on at SESHA. And it's basically looking at heat and air pollution at the moment and focusing on those vulnerable groups. What I'm particularly interested in is perhaps this slide. And you can see it, Jonathan, it's got three boxes. Do you see, are we seeing the same thing?
Yes, we can see them.
So this slide
2040.
shows, it shows how temperatures in Southern Africa are expected to rise based on data from 30 climate models used in the IPCC. So it looks at 3 time periods: the near future, the 2021 to 2040, then the mid future from 2041 to 2060, and the far future until 2100. And the baseline is really 1979 to 2014. And what it is trying to emphasize is the warming will increase steadily, with the biggest temperature rises happening towards the end of the century if high emissions continue the way they are at the moment. And for Southern Africa, because this is the bit about Southern Africa, this warming poses profound challenges to health, agriculture, water resources, and urban resilience. So vulnerable population groups such as outdoor workers and rural communities are likely to bear the biggest brunt of these impacts. And again, this emphasizes the urgent need for adaptation strategies and policy responses tailored to the African context. So with this slide, I was just trying to highlight the attributable changes caused by climate impacts, particularly in the Sahel region. Recent unprecedented rainfall led to catastrophic flooding in Sudan, in Niger, Chad, and Cameroon, displacing millions and claiming over 2,000 lives. And these events, now more than ever, are more frequent and severe due to historical climate change. And this highlights how the probability of such disasters has likely doubled. Vulnerable groups already grappling with conflict, poverty, and weak water management systems, for example, are disproportionately exposed to these extreme floods. And again, this exemplifies how climate change transforms rare disasters into common events, compounding existing inequities and demanding urgent and perhaps more systematic responses on the continent. The talk earlier by Shaman Tai on his presentation was really interesting because it sort of resonates with what I'm trying to say here, that for sub-Saharan Africa, a significant proportion of the workforce, about 55 to 62%, is employed in agriculture, with 95% of cropland, which is rain-fed, making livelihoods highly dependent on increasingly unpredictable weather. Additionally, rapid urbanization has led to growing informal settlements, with nearly 60% of the urban dwellers living in precarious conditions and over 60% of the workforce in the informal sector. And what compounds these vulnerabilities, the population's infrastructure and agriculture are increasingly concentrated in climate-exposed areas, such as low-lying coastal zones. And as a result, mortality from climate-related disasters is now 15 times higher in highly vulnerable countries, demanding urgent, equity-driven interventions. With this slide, I'm trying to highlight that climate change has caused losses at all levels, from community, households, and at individual level. Families face crop failures every year. Food shortages are now a common thing. Higher prices and are forced to sell assets, trapping them into poverty. Children lose out on education and development. Working conditions, lower incomes, and fewer options to adapt, as they depend on fragile local economies that are tied to agriculture and informality. These challenges highlight the now need for policies that protect the workforce, the outdoor workforce, and communities from climate impacts. Now, to put things into context on what we mean by outdoor workers, there are nice parallels with the work presented earlier on the qualitative work the sun, rain, and dust, no problem, because the type of outdoor worker that they were describing is exactly the type of outdoor worker that also resonates within the context and mostly across Africa. So outdoor workers come from many roles, including community, you know, what you're seeing there is a community healthcare worker, vendors, farmers, teachers, and cattle headers, as you can see here. And all these groups face challenges working in tough conditions like extreme heat, rain, and dust. These workers are critical to local economies, but they often lack the protections they need. And we've heard this since morning. And again, it highlights the need for policies that speak to their vulnerabilities, to their context, and ensure fair support and working conditions. Now, in summary, without necessarily getting into the individual studies that we're implementing in Zimbabwe, outdoor workers, you can see from these examples listed on the slide, across Africa, outdoor workers across Africa are among the hardest hit by climate change. They face extreme heat, their working conditions are precarious, and they have limited support, if any at all. For example, in 2024, market vendors in Bamako in Mali, they endured a severe heat wave that led to 80 heat-related illnesses in a single week, with 25 requiring intensive care, which is often limited because healthcare workers are not always available. And this was due to prolonged sun exposure and inadequate hydration options. So from tea pickers in Kenya to fishermen in Senegal, workers experience rising cases of heat exhaustion, dehydration, disrupted livelihoods. And again, we have seen multiple examples in 2023 and 2024. Most of them are left vulnerable due to gaps in governance and inadequate policies that are informed by evidence. This highlights the challenges workers face when governance fails to provide safeguards against climate impacts. So the question on bridging the academic policy divide is essential to ensure research on heat and climate change informs practical interventions that protect these workers, prioritizing their health, their safety, at least in the definition that the earlier speakers defined safety, and resilience as climate challenges worsen on the continent. Now, this slide is really about the economic and health impacts, but also looking more broadly at the political economy of the outdoor worker. And across Africa, like I said, they are hardest hit, but there is a need to come up with interventions that really speak to their economic needs, considering what they contribute, but also the impacts on heat, through heat, as a result of heat. Africa has definitely made progress in addressing climate change through robust legal and institutional frameworks, blending modern governance with traditional knowledge systems. We have nice examples from Tanzania and Rwanda that have integrated climate change. And the National Climate Council in Nigeria has done a lot, but there are still gaps. And we continue to see heat stress reducing productivity and increasing illnesses and overwhelming health systems. And women tend to suffer the most. And as I said earlier, there is nice progress. There is progress. We can't say there isn't. Community engagement, for example, is seen in Kenya's adaptation strategies and the formalization of indigenous knowledge practices, like in Tanzania's Makorongo village forest. Institutionalized bylaws exist. That means there are institutional arrangements to try and think about resilient communities and how to protect workers. And this highlights the importance of local voices and knowledge in co-production of these interventions. These efforts showcase Africa's proactive stance in leveraging legislation and tradition to strengthen climate resilience and align with global commitments like the Paris Agreement. Now, with this one, even if there is progress in addressing the impacts of climate change on health, with several countries, of course, leading the way in adaptation and mitigation, like South Africa, which has passed the climate change bill. In Zimbabwe, the climate change bill was lodged in parliament last year. And most countries in Southern Africa have launched the National Heat Health Action Guidelines. There's still a lot of work, but there is progress. While other nations like Kenya, Ghana, and Malawi, they have developed national climate adaptation plans. Ethiopia is implementing its climate and health adaptation plan already, and early warning systems for diseases like malaria are being expanded in Eastern and Southern Africa. But despite these challenges, these achievements, there remains critical gaps that need to be addressed to ensure the progress is equitable and sustainable for all populations, and particularly for workers. What we have seen, at least from some of the work that we're implementing, is that Africa continues to struggle to bridge the gap between academic research and policy implementation in climate health solutions. So, and the most critical issue really is misaligned timelines. Technical language in research, I think, Jonathan, you spoke about publication earlier, and the lack of multi-sectoral platforms. These hinder the translation of evidence into action. Ethical concerns around knowledge generation and its use remain underexplored, further complicating this progress. And vulnerable groups like outdoor workers and rural communities, they continue to face increasing risks, such as heat waves, and critical policies on heat early warning systems and workplace adaptations remain insufficient. So to address this, we talk about collaborative platforms, and we continue singing that, but making this a reality is where the gap is. How do you actually create collaborative platforms that work in situ? What does communication mean between different sectors that have their different priorities? What are the ethical frameworks that work within our context that are not too Western dominated? And how do you turn science into effective and equitable policies? These are some of the critical questions that remain. There are also operational implementation challenges. For example, enforcing climate-related laws with limited evidence is really difficult. Such laws strengthen resilience or reduce vulnerability, but really making them practical to produce the kind of effect or output that we want to see is problematic, it's difficult. And there are many reasons for that. And one of them is really knowledge and capacity aspects. These gaps, they persist, particularly around the vulnerabilities of specific groups like indigenous communities and outdoor workers, which hampers the development of targeted adaptation strategies. Local governance and primary healthcare systems, they remain underprepared for climate risks, and legal frameworks often fail to protect or even undermine indigenous land rights. So while traditional systems and indigenous knowledge systems are acknowledged, their integration into policy and law is inconsistent. And these are missed opportunities for what is culturally relevant, what is really community sensitive and community grounded. So to bridge these gaps, we must really focus on enforcement and integrating local knowledge and protecting vulnerable people to ensure inclusive and effective climate adaptation. So we tried to do that. Last year, we were very fortunate to be funded by Wellcome Trust to convene and learn from the first International Climate and Health Africa Conference, which was hosted in Zimbabwe in October 2024. And at CHAC, we call it CHAC, at CHAC, we addressed the gap between academic research and policy making, but also a component of legislative engagement and capacity building. And the idea was to really emphasize the need for co-creating the knowledge we need in order to inform policy, and fostering multi-sectoral collaboration and amplifying the voices of vulnerable groups like outdoor workers and rural women. But what we learned is that challenges, again, are on timelines and underrepresentation. So the need to align what is coming out of research and what the policy priorities look like is very important. Now, taking you to some of the summarized learnings, I tried to put these in a table. Hope you can see that.
Yeah, we can. Do you want to sort of summarize quite quickly, Fortunate? We're running out of time this end, if that's possible.
I think this is one of my last 3 slides. And here I was just trying to say the gap remains, the academic policy gap remains a key barrier to addressing the climate health nexus in Africa. And the challenges include sparse data on heat health impacts for these workers, and limited support for scaling community-led solutions. But before I finish, Jonathan, I wanted to just say it's inadequate to talk about all this work without really framing this work within the global diplomacy debate. So the books by, and I won't get into detail about this slide, but these books by Stefan and David are quite interesting with their colleagues, and they explore how climate change has shaped and changed global politics, often reinforcing power imbalances. So we can talk about adaptation and support, but retracting from the Paris Agreement is not going to affect wealthier nations. It's going to affect low-income countries, and particularly these vulnerable groups that we're talking about. So they try to highlight how environmental injustices, especially in Africa, are exacerbated by limited resources and influence. And their work calls for amplifying Africa's voice and ensuring equitable resource access. And I think these sort of insights resonate with earlier discussions that we had from earlier presentation. So let me wrap this by really focusing on key points from what we've learned in our work, and from the Climate and Health Africa Conference. I know this is too busy, but hopefully you can get the slides later. Africa needs strong regional collaboration, and I think there are nice parallels with earlier presentations about Vietnam. We need resilient infrastructure and grassroots empowerment, equitable access to climate finance, fostering innovation, and ensuring education and knowledge sharing. It's really critical in order to bridge that academic policy divide. Convenings like the Climate and Health Africa Conference are really important for bringing together stakeholders to strategize and act on these strategies. Africa must also make its voice heard in global climate negotiations. But this approach isn't just for Africa. Other regions can also learn from it too. Of course, there are solutions that need to fit the local political economy and context. And the climate crisis doesn't choose who it affects, but the impacts hit harder where inequities already exist. So I like the fact that, there's this work happening in Vietnam and the ease of talk from Africa. So by uniting efforts, starting with such, Africa has the opportunity to turn these challenges into resilience and equity, and hopefully offer a path forward for the world to follow as well. Thanks, Jonathan. I'll end here.
Wonderful. Thank you, Fortunate. That was a fantastic presentation, very insightful. So I think what we'll do is we'll just have maybe 3 minutes, see if there are 1 or 2 questions, and then we'll ask the panel members perhaps to reflect on your presentation as well. But are there any questions from the floor?
We should give the chance to go there. No question.
Sorry, no question. Okay, right. Thanks, Fortunate. What we might do now, I'm just going to invite Locke and Dan up to the front here. Do you want to come up and we'll kind of do panel? Can I just check, is Dorothy online?
Yes, I'm online.
Hi, Dorothy.
Hello. Can you hear
Well,
me?
we can't. Can you turn up your mic a little bit?
Okay, let me. Can you hear me now?
Very faintly. Can we do anything about that or not? I'm just looking at the technicians to see whether. Do you want to speak again?
And now? Still faint?
The problem apparently is at your side, Dorothy. Is your mic?
Okay. Now?
No better.
No, not better. Okay, let me try to do
that's
something.
That's it. We can
Is
hear
it
you now.
better?
Yes, that's better. Can you?
Okay.
Yes, you can hear Dorothy. Okay. Right, Dorothy. I'll just introduce you, and then perhaps you can respond to both Fortunate's presentation and those other questions. But I'll just introduce you. So what we're doing now for half an hour is we're going to get the panelists to reflect on, well, the kind of policy end of these questions. I've suggested to them they reflect on the challenges that they're faced in their work regarding engaging with policy. So in fact, some of the things that Fortunate raised, and then highlight what they regard as the key outstanding issues. Again, Fortunate highlighted a couple of those, and we'll see what the, whether our panel kind of agree on what those issues are. But Dorothy has to leave, I think, for another event. So I'll just introduce Dorothy, the one person who hasn't been introduced yet. So Dorothy Ngajilo is an occupational medicine specialist at the WHO in Geneva. She's responsible for supporting WHO technical work in occupational health, including development and implementation of occupational health and safety programs for health workers in different countries. Prior to joining the WHO, she worked in the Ministry of Health in Tanzania as an occupational medicine physician and technical advisor to the Tanzania Workers' Compensation Fund. She's a medical doctor with occupational medicine specialty training from the University of Cape Town and a fellow of the College of Public Health Medicine, Occupational Medicine of South Africa. So Dorothy, over to you.
Okay, thank you so much, Jonathan. Being mindful of time, I'll keep my intervention short. Apologies. My apologies, I'm receiving calls for another meeting. But yeah, being mindful of time, I will keep my intervention quite short. First, to reflect on Fortunate's presentation, which was really great, summarizing some of the key challenges, but as well as opportunities across the continent of Africa. And myself, coming from Tanzania, I've done some work on occupational health, linking health of safety of workers and climate change. And what Fortunate has spoken about in general across the continent really is similar to what I've found in Tanzania, particularly in Zanzibar, where I conducted this type of research And just to bring it back to the work that Anne and colleagues are doing, there is a lot of parallel as well in terms of outdoor workers in Vietnam and what I've seen in Tanzania, in Zanzibar in particular. So these issues similar, but as people say, we might all be in the same storm, but probably we are in different vessels. So there's some different differences in terms of the challenges and how, not necessarily challenges, but how we intervene with the challenges. So going straight to, I think I had some, I was privileged to get a few minutes maybe to speak about WHO and our work on climate change and heat exposure to outdoor workers. Just to highlight some few regulatory or frameworks that govern our work. First is the World Health Assembly Resolution on Workers' Health, which in general guides our work on protecting workers, including informal workers and outdoor workers. But also last year, WHO passed a resolution on climate change and health, recognizing climate as a major threat to health, but also ensuring that climate action prioritizes health. And this includes health of everyone, including the informal workers as well as outdoor workers. So in response, in the next 4 years, WHO has prioritized climate change and health in the global program of work. So you hear a lot about climate change and health from WHO, but specifically on heat stress for outdoor workers and for workers, including outdoor and indoor workers. So some of the work that WHO will do is develop standards, global norms, and basically providing recommendations on global recommendations on how to protect workers. And in the next few months, there will be a global guidance on climate change, occupational heat stress, and outdoor workers, which is co-developed in WHO and the World Meteorological Organization. We also work to strengthen health systems to ensure that health systems are able to respond to the increasing challenges of climate change, developing national and regional work plans. So it's very encouraging to hear about the ICANN project and the app. So that type of work also to ensure that there's health action plan, early warning systems for outdoor workers and other workers. So to expand that to at the global level. Supporting policy revision and legal reforms, because most countries do not have policies that protect workers from heat or outdoor climate-related challenges. And also supporting research data to ensure that all the recommendations that come out are evidence-based. So in terms of challenges, as I wrap up, the challenges that are very common is, again, lack of regulation. Fortunate has mentioned that, and we've had over and over. It's like lack of specific regulations for the climate-related hazards and limited enforcement of these regulations. And also some of the challenges for policies, also having a big informal economy in majority of countries, and these are not included in the regulations that in the occupational health and safety regulations. So that's a big challenge. But one of the challenges that I think is also very big in terms of policy implementation is the lack of coordination. There's, as we can see, like this policy of for protecting workers requires collaboration because it touches health sector, labor, environment. And what we see most of the time is there is fighting for resources or funding. People sometimes are very territorial, feeling, okay, this is an environmental issue, or some, when you talk about workers, somebody says, oh, this is a labor issue. And when you talk about health, someone will say, oh, this is a health issue. And from the government level, there's no, these sectors don't speak to each other. So there's lack of coordination. There's a lot of duplication in terms of policy. So that's a big challenge that we see. And one of the ways that we're doing is to ensure we bring everybody who's concerned on the table so that we can create recommendations that first they don't duplicate, but also ensure that we use resources quite effectively. So that would be my intervention. And if there's any question, I'll be happy to take later. Thank you.
Wonderful. Thanks, Dorothy. Can you stay with us, or do you need to go to another meeting?
I'm going to another meeting, but I'll be on just monitoring. If there's any question, I'll probably be monitoring the chat section, and then I can respond.
Okay, great. Anyway, thank you, Dorothy. That was a wonderful intervention. So, what we're going to do now, I'm not sure if there's work. We're going to work our way along. So we've got the panel who you know already. I think we'll start with Dan, then we'll go to Locke, then we'll go to Anne. If you can kind of reflect on the day, also maybe if you've got questions for Fortunate in terms of her presentation, things you might want to follow up. And then right at the end, I'll give Fortunate a chance to respond to any issues, questions that you've raised. Okay, so Dan.
Jill, I guess just speaking specifically about how we integrate science into, say, national adaptation plans. I think understanding the context of the country is particularly important. And in the UK, a lot of what our government asks us is not the health implications of climate change, it's the monetized version of those health implications. So really what they want us to do is calculate a mortality rate and then convert it to a financial rate, and essentially you do a cost-benefit analysis. When said like that, it sounds very cold, and essentially it is. In the context of the previous talk in South Africa, having spoken quite a lot with the South African Medical Research Council, there seems to be more scope for adaptation based on just the health outcome rather than the economic outcome. And I welcome Fortunate to comment on that and tell me if I'm wrong, of course, on that one. She knows more, but it's the individual context of the countries that's important. Within the UK in particular, a lot of the money for climate adaptation or responses actually at the council level. I mean, the government distributes money down to the council level, so you see climate resilience programs being quite different around the UK. So I'd be interested in particular to see how that works in Vietnam, especially in the context of having, say, the 4 cities we've spoken about, they have very different budgets to respond. So I'll leave it there, and yeah.
Yes, in my spirit, I think we will to expand the term of the construction with to consider test order policy for the local government. So I think that the research become the bridge to between the outer worker and the local government, and the researcher can provide the strong evidence for the political maker. I think it is very important to support the outer worker in the constructive map. Is my experience. In the past, some NGO to research to the tiding, and we have a strong critical. It is the same tiding. I think that's the road not suitable for us. We have to support all the political people and the strong evidence result, so they can feel the political good for the other world. Yeah. Thank you.
Yeah. Thank you, Fortunate. It is really fascinating presentation. And from the challenges you presented in your presentation, I really resonate with the challenges and the issues in Vietnamese context. So, first of all, about the territorial politics and the lack of the multi-stakeholder platform dealing climate change and health nexus.
think that is the point that somehow that resonates with, unfortunately, because in Vietnam at this moment, the health issue is quite missing or not, is quite overlooked at the high level of climate change adaptation and mitigation documents such as NDC or National Adaptation Plan. I mean, climate health is quite missing there, not even mentioning the elder workers. So, and the health and climate change, I think I have mentioned quite often that quite still treated in the silo manners, and the health still going on with health. Of course, there's an increasing attention by the health policy makers now in integrating climate change into the health sector. But from the environmental and climate change department, health is still like ad hoc, add-on topic. And another thing, I want to say that the Vietnamese government now that the adaptation or mitigation now is quite focused in the rural setting. We for many years we really the Vietnamese government quite advanced the hardline infrastructure adaptation mechanism. So they do a lot of embankments, and water treatments and in the rural settings. But adaptation in the urban setting and how it is attuned or tailored to the vulnerabilities of elder workers is still missing. And there's not much policy discussion going on in the urban setting, how the climate change adaptation or mitigation needs to be, in place to support the elder workers. And the occupational safety is the focus on the formal sector and not focused on the informal sector. So there's a lot of policy documents focusing on the occupational health safety, but that's for the formal sector. And I think there's a lack of data and monitoring mechanisms. I think the environmental indicators and climate change adaptation mitigation indicators in the national data infrastructure in Vietnam is quite concerning, and because I think the demand for the data is also very high, but the capacity for the government and the subnational level is still limited. So we do not have very good data evidence about the climate change and environmental conditions, etc. And that's why the issues around the impact of climate change on vulnerable groups is still very overlooked. And most of the policy documents now, I think also reflected in Jonathan's presentation, is that all the intersectional approaches, all the characteristics, sociological dimensions such as gender, ethnicities, etc., are not addressed in the policy documents. So I think somehow quite resonate with Fortunate.
Great. Do we still have you online, Fortunate?
Yes, I'm still here. So I'm picking bits and bobs because the speakers are a bit far from the microphone. But I think I can tell some of the points that they're highlighting. So I'll speak to those later. Yeah.
Great. Did you pick up Dan's question or points about your presentation or not?
Yeah, for N, I couldn't pick the question.
Dan? So Dan Mitchell, not?
Yeah, I think for Dan, he was talking about the really focusing on highlighting economic losses for policymakers to do something, given that financial metrics tend to resonate strongly with their decision-making processes. And he was, I think, asking experience or thoughts on that. Is that correct?
Yeah, that's correct.
Okay, yeah. So, John, do you want me to respond?
Yes, do you want to respond for a couple of minutes? Then what I'll do is I'll open it up to the floor.
Yeah.
more 10 minutes to see if any questions, both in terms of your presentation and also more general questions in just a moment. But do you want to respond specifically to Dan's question?
Yes, thank you. So I completely agree with Dan. Policymakers can definitely better justify allocating resources by showing the return on investment in terms of lives saved and economic benefits and so forth. But there's still a lot of problems, Dan, issues to do with data access, like reliable mortality rates or economic productivity, healthcare costs, they're often inconsistent if they are there at all. So it makes it harder to make accurate financial conversions, and really difficult. And again, that highlights the kind of gaps that exist between researchers and policymakers and where we need to focus. Then, there are underrepresented vulnerabilities. So, for example, issues to do with informal workers, particularly women, they are not adequately accounted for in economic loss calculations. So again, this may underestimate the true impact. There are also aspects to do, with ethical concerns around that when you undermine certain social groups because they are not counted. So while that is important, there remains aspects to do with data access, infrastructure to support that data, and capacity to produce that data. So this would be really important in order to bridge that academic policy divide. I don't know if this sort of speaks to what you were saying. I didn't quite catch everything.
Yeah, I think we're on exactly the same page. I guess I was saying in the UK context, where some of those financial models are a little bit more stable, although still very uncertain. Our politicians can use it. I think just responding a little bit to one of your points is, I do feel some governments and some politicians use our lack of certainty in the financial part as a way of not actually acting. So there are proof of evidence, which, as you rightly point out, is very difficult to provide them with strict certainty. So it's a bit of a sort of double-edged sword from our side.
Yeah, there are, however, there is some work happening at WHO Afro level. There's the Clean Health Network established through the WHO Afro, working with different policymakers. And one of the things there, at least in the strategy for the next coming few years, is to really talk about data infrastructure, so that even if calculations are not able to happen or can't happen at country level, at least there are regional sort of estimations that could be used at country level, maybe as a starting point, given some of the deficiencies in the data infrastructure at country level. It's not big, but it's something.
Great, that's excellent. Right, we've got 10 minutes left and then a reception. So I'll see if there are any. Yes, yeah, sorry, and then closing remarks, then the reception. So you'll have to just hang in there for a little bit longer. But are there any questions from the floor? I think about this kind of policy research interface, about Fortuna's presentation, indeed, Locke or Dan's as well.
Hi, thank you for amazing data presentations. I've learned a lot. My question goes back to the presentation that was on the kind of first qualitative results that you've received from the project. And I was really struck by the claim that your respondent made. I think there were a couple of different quotes, but the same kind of sentiment to do with the weather's changing, but we still work. Whether it's hot, cold, there's dust, there's still a need to go out and earn a living. I was wondering how the team has kind of understood that demand, that claim. Is it to do with a kind of lack of knowledge of the health risks that are involved in working during extreme weather events? is it a acceptance that those risks exist, but an acknowledgement that at the same time climate change is reducing the economic opportunities that casual workers have? Or is it a sort of sentiment that presents a kind of difficulty for the team, I suppose, is my third consideration of it, in the sense that it's reducing the ability for you to be able to demonstrate who is responsible for workers going out and working during extreme weather events. Or maybe there's some other reason why you have that sentiment. And I think the sentiment is also interesting because I suspect it's a universal one, that if you were to ask outdoor workers in other contexts, you would have a similar response. Thank you.
Great. I'm not sure who would like to respond to that. And indeed, fortunately, if you'd like to respond to it from an Africa perspective, please do. No, Locke? No?
It is a very great question, Joshua. And then you're putting us in the spotlight now. So I think, I think whether that claim, no matter what, rain or hot wave, heat wave, cold wave, dust, we put our kids back to the street to keep working, whether it is because it is lack of knowledge or because of the economic opportunity brought by climate change. This is really a great question, and I think we need to lead people, to dive people into the qualitative interviews next round. But I think so far they have many of them have pre-existing health conditions, and they have cardiovascular disease, and even the anxiety, distress. So, and that is coming out now by the workers in all working occupations have a lot of pre-existing health conditions. So when the in-depth interviews approach them, they tend to normalize it. And I think we need an extra layer, to ask in the next round interview whether they tend to normalize it or because they do not know, they lack knowledge about that health risk. That is, it is really, I think, really great point. But so far, what we capture is their tendency normalization of their health risk. You want to add to that?
Maybe add quickly three things I think maybe of work in addition to what Anne's talking about. One is that if you're migrant from a rural area, and I think this was something that, in fact, Mike brought up in his presentation, there's a kind of obligation to generate income to send back to your native village. So there's a lot of pressure in terms of, I suppose, a different type of moral economy. Employers, if you'll lose your job if you don't carry on working. So there may be a recognition that, yes, this is not good for me and it's really hard, but I know that if I stop, I'm going to be out. So there's a kind of lack of protection. And I suppose at a broader level, who's going to step in and help? You've got to keep working because that's your only source of income. And maybe your point, Josh, that if this is a contracting opportunity, set of opportunities, you don't want to let them go. So I think all of these things intersect in interesting ways to create that sort of contradiction that people will carry on working, even when they may know that there are health implications. I mean, I think I think Lei and Nan have probably gone to bed by now in terms of their presentation, because it's 11 o'clock at night, so I can do it now. But I think that's something they could tell as well.
Yeah, one very quick addition to that is there's a difference between very impactful weather, which you know about, and very impactful but less frequent weather, which you don't know about. And if I were to ask the question of the audience, what type of weather events do you feel saw the largest increase in A&E here in the UK in the last 10 years? I suspect most people in the audience wouldn't have a clue. I suspect if I asked that question of people in the UK, no one would really have a clue. Most people would think of something like a storm, because they see how violent the storm is. Actually, in the UK, during storms, our A&E attendance goes down because people are so aware that storms can be. So the largest event was actually a summer thunderstorm, which caused asthma attacks. So this idea of thunderstorm asthma, and we saw 5 times the amount of people in A&E in here. But even asthmatics in the UK were unaware of that because most thunderstorms don't cause that impact. And so, in the context of Vietnam, air pollution is a huge factor, but not every air pollution weather event is created equal. And I think if there's a way in the app, for instance, of really distinguishing between different events for people with certain health conditions, that not just asthma, it could be the type of medication you're on. So we see certain medications make people a lot more vulnerable to different weather events as well. And that's a great outcome for these sort of things.
Okay, maybe a chance for 1 or 2 other questions. Maybe I take 2. Yes, question at the back there. Please, Benedict, isn't it? Yes.
Yes. Firstly, thank you very much for a really, really interesting day of presentation. Similarly, I feel like we learned a lot. I just have a question on whether, in your opinion, do you think we can sort of expand the findings of this project to sort of make it more regional? I guess it sort of draw a picture of the region. Obviously, Southeast Asia is home to a lot of megacities, Bangkok, Jakarta, being particularly good examples. I wonder, sort of, in your view, are there similarities with sort of high levels of rural to urban migration, high levels of street sellers, construction workers working outside? It seems to me that perhaps it would be possible to sort of find similarities across the region, maybe with like Bangkok in Thailand or Phnom Penh in Cambodia. I just wondered if you have any thoughts on that.
Great question. Is it worth maybe 1 more? We can take 2 and see what the panel think. Yes.
Yeah, just really quickly, I just wondered what kind of things might be on the agenda. So the policy toolkit. So kind of coming out with some of the comments, where would you start with that toolkit? One kind of question in terms of policy recommendations. Is it the social protection system that needs to change? Do you need to reduce the size of the informal sector? Because almost by definition, some of the problems are caused by the informality, and if that was formal, it different. So I wonder what the kind of agenda was in terms of those policy recommendations. Also just a reflection that there's quite some emphasis in what we heard this session on the role of data in those changes. I mean, is that the kind of the predominant policy route here, that somehow kind of better monitoring and more awareness of the data is what drives policy change?
Great, so I'll work through, and then if Fulton and Dorothy is still on, I'll see if they want to respond as well. But maybe start with Locke. Do you want to go first? Do you have any responses to the questions, or? Chairman? Yeah. Yes.
We also to express the agenda, but we will to make it about intervene. We will to focus to fighting. Now we have to give this to the agenda. I think we can get more information more than time.
Maybe we just go online. Fortunate, are you still there? Would you like to respond as we're winding up?
If I got the question correct, I think there are opportunities. Both regions can definitely learn from each other. So, for example, by sharing frameworks for early warning systems, for example, labor protections and community-driven adaptation strategies, and maybe collaboration on data sharing and funding mechanisms could strengthen regional and global responses. But there are some other differences. So, for example, it would seem that Vietnam has stronger centralized governance and perhaps more established integration of climate health policies, like maybe early warning systems into national frameworks, while African policies often face fragmentation and weaker enforcement. And then also Africa deals with the additional legacy of colonial economies, leaving rural and informal sectors particularly really vulnerable. Whereas, I don't know, I think Vietnam's socialist governance has focused on national cohesion. So that's a difference maybe in the interpretation of whatever findings that we'll need to consider. I'm not sure really about the context in terms of data collection and monitoring systems, but I know for certain that Africa struggles with regional data gaps and underfunded research. Although I think we are agreeing that the climate health challenges are faced in both regions, and particularly for vulnerable outdoor workers in agriculture and construction. And we also are agreeing that health risks like heat stress and dehydration, maybe vector-borne diseases, come with limited adaptation frameworks in policy and in situ. So there are those similarities and differences, but also exist opportunities that we should leverage.
Great, thanks, Fortunate. Have we still got Dorothy online or not? Don't think so. Okay, so Dan, then wrap up.
Yeah, I guess quickly in response to the can we learn anything from the other cities, and I think for certain vulnerabilities we certainly can. And so if you think of heat mortality and you think of age, then that's something that's sort of pretty much universal. I've only seen one paper which sort of said the elderly are not more susceptible to temperatures than other people, and I'm not sure I trusted that paper if I'm honest. That's something universal, and there's been some good analysis which shows you can get a relationship between heat and mortality for cities using around eight different parameters such as GDP, certain poverty matrices, things like that. What you can't get is some of the more nuanced stuff, and I think, for instance, gender is a really difficult one to say, well, how do women versus men respond in this city versus another one, because often they have very different cultural roles, or caring responsibilities, or for instance, birthing ages. So some of the countries in, say, East Africa, then women are given birth a lot younger than, say, here in the UK. So yeah, I think for Asian things, but actually that's quite a simple one to deal with. I think most of the vulnerabilities are very city specific or country specific.
Yeah, so two responses. One response to Benedict. Definitely, I think when I presented, you see the cities in Vietnam, Ho Chi Minh City and Cần Thơ, they have tropical monsoon climate, and definitely resonate with Thailand. We are all at the lower Mekong sub-region, so definitely in terms of climatic zones, we have some similarities here. And in terms of economic development and informality of the work, informal sector and outdoor workers, definitely there's a lot of similarities. And hopefully in the future we can apply for the bigger grant with the Local Trust or SEO. Who knows? We can do that extended work. And the second response to Graham's question about the toolkit. So the original idea here, I think, is very straightforward. How we can integrate health into the center of climate change response policy. That is the original idea. But now we continue to discuss. So who are the users of this toolkit? If we think the users are the policy makers, we need to ask whether they are willing to adopt it, because normally the government, like, the government in the context like Vietnam, they are not always welcome some kind of guideline from the non-state actors. So we need to think, to calculate, the feasibility here. So, or the users can be the workers. So in the capacities, their knowledge about health risk, climate change related health risk. So we need to identify who are the users of this toolkit, and then we will find an entry point from there.
Excellent. Right, we better wrap it up. We've run over time. Can you all join me in thanking our, well, 3 speakers here, also 2 that's not online. Thank you.
Thank you.
No, we are entering the end of the day. This is really my great honor to invite Dr. Madeline Thompson. She is the head of impacts and adaptation in the climate and health team at Wellcome. And Madeline has, hello. Hello. I think not, is anyone still online? Otherwise, we don't need microphone.
Yeah,
No,
I can hear you. Can you hear me?
No. No.
Hello, can you hear me? And
Hello. No. Sorry, we need to talk to microphones so that online participants can hear us. Thank you. Sorry, let me restart. So it's my it is really my honor to introduce Dr. Madeline Thompson. She is the head of impacts and adaptation in the climate and health team at Wellcome. Madeline has over 25 years of research experience focused on large-scale climate-sensitive health interventions in low and middle-income countries. And her research has involved the development of new data, methodologies, and tools for improving climate-sensitive health interventions with a focus on infectious disease, public health outcomes of hydrometeorological disasters, and nutrition. Madeline is also visiting professor at the Center for Health Informatics, Computing, and Statistics at Lancaster University Medical School. And prior to joining Wellcome, Madeline worked as senior research scientist at the International Research Institute for Climate and Society at the Columbia University, where she directed the WHO Collaborating Center on Malaria Early Warning System and other climate-sensitive diseases. It's my pleasure.
Yeah, well, thank you. It's my pleasure to be here, and I think I just have a few minutes to help in the wrap-up process, and I wanted to share some information on Wellcome that I thought might be of interest to you. I've been at Wellcome now 5 years, and what I understand, which is it's a fun job being a funder. I know what it's like being an academic, and it's also a fun job, but it's always a struggle to get resources, etc. One of the things that's really clear when you're a funder, though, who does the real work? It's the academics, it's the researchers, it's the people who are doing the field work, the communicators, etc. So a huge thank you, first of all, for delivering for what we need to do, which is to enable societies to better manage climate change and to use health as an argument to drive mitigation strategies. So a huge thank you as a starting point. I just wanted to give you a little bit of an update on Wellcome. We had a new CEO come in, Jan-Arne Rüdinger. It came in last year. We've tweaked our strategy, which changed in about 2020, and we now have a building that is focused on discovery research, which has always been the mainstay of Wellcome, actually, and is still a very substantial part of our portfolio. But we also have renamed the area which we work in, climate and health, as the solution space. So this integration of research into strategies that can support policymakers make better decisions is a really critical part of the solutions idea. And within the solution space, we have not just climate and health, but also infectious disease and mental health. And another big part of Wellcome's new strategy has been to work across the building. So when I started here 5 years ago, I was in a team called Our Planet, Our Health. And that team really worked in a little silo. It was very nice. We did lots of interesting stuff. Now we work right across the building. And we have not only the research teams that we collaborate with, mental health. We just did a close on a call for extreme heat and mental health. We have a whole bunch of proposals that are now going through the review process on that. We work with our infectious disease team, and we also now work with Discovery as well, looking more at the molecular impact of extreme heat on organisms, including human. Those that affect humans. So within our climate and health strategy, very much the idea that putting health at the heart of climate change action, both from the mitigation and the adaptation side. And investing in research across diverse regions and countries and communities to understand how and to what extent climate change affects health. It's really important. We need arguments that are based on evidence and to inform evidence-based health-focused climate mitigation and adaptation actions. And then we want to strengthen the underlying ecosystem that supports research in this space and look to inspiring and urgent, ambitious and evidence-based policies and initiatives that prioritize health in this context. So I do encourage you, if you're not familiar with it, to look at the Wellcome website. It's been a bit slow to get going, but there's more and more material on it about the work that we do in climate and health. All you need to do is sign up to the monthly newsletter, and you'll get information on the different calls or the different funding activities that we've undertaken, etc. And within the context of this call that supported this grant, the Year 1 Climate Impact call, I just wanted to give you a little bit of background, actually. So this was very early on in the development of our new strategy. Wellcome was a very long experience, if you like, in terms of funding fairly pure research. And the strategy at the time was you fund the research, and when they're in year 4 or 5, they come to you for some additional funding for dissemination. That was the kind of model, traditional academic model. And this one, where we said, no, we want to have policy makers in from the get-go, helping to shape the research, understanding the policy space, building out the communication strategy, doing it all from the start, was a very new activity for Wellcome. And it came really out of the urgency of climate change. Climate change is not something that's interesting. In fact, I'd be quite happy not to work on it. It's something that's necessary and that we need to do. And it creates all sort of interest in its process. But fundamentally, there's a huge urgency around this. We can't wait 5 years for some nice research paper and then think, is that research paper useful? We want to know from the get-go. And we also want you to adjust when you realize something's not going to happen because you don't have the right connections, or the winds have changed, if you like. We have a lot of winds of change at the moment in the global climate and health space. You need to be flexible enough to readjust your programs and to understand the policy space well enough and the communication strategies that you want to use. So we want to be a flexible funder. We want you to have a broad view of change and how your work can affect change locally. And so just the initial inspiration for this, if you like, was a workshop in New York at New York Climate Week, I suppose 4 years ago, where it was all focused on loss and damage. And one of the representations from the small island development state said, all the non-economic losses that we experience are just not calculated. So we never can bring them to the attention of policymakers. And so it's like, okay, health is a major non-economic loss. We can calculate some of the economic losses, but there's a huge other part that is non-economic. And as Wellcome, we can help. So that was the kind of thinking that motivated the origins of this call. And we have the 3rd year, because it's a scheme. We have the 3rd year, it'll be released early in February. So I encourage you to go and have a look. We had earlier on with Dan's talk, the work that we're doing on attribution. We do a lot of work with our Data for Science and Health team. And that's quite important for us to stand where all of where climate fits in, if you like, with a hierarchy of all sorts of other drivers of health outcomes. We need to be always mindful that climate is not the only thing. But some other, I don't know if you've seen these documents. Maybe you're very familiar with them, and maybe you found them weren't helpful, or maybe you thought they were brilliant and you just used them. But if you haven't seen them, one of the things we were looking at is how do you combine health and climate data? And we had Hannah Nissan, who's from the climate side, and Peter Diggle, who's a big time health statistician, work on like what's the interface between climate and health data, and how can we explain that in such a way that researchers don't always have to start from scratch and try and figure all these things out. So if you haven't seen this document, it's online, Combining Climate and Health Data. It has a whole set of recommendations for researchers, but also for us at Wellcome about what we might understand as the challenges that researchers need to overcome when integrating climate and health data. We also have work on population databases, and longitudinal population studies have been a mainstay, if you like, of Wellcome investments for many years. And we have explored like the HDSS study sites in Vietnam, where they look at longitudinal data using the which go on for many years through the INDEX network. And we asked colleagues to actually create shapefiles for all of the HDSS sites around the world, so that researchers, when they go and use data from these long-term cohorts, don't have to go and try and figure out where's that data actually coming from. How would they integrate it with climate data, which is always in the wrong scale and the wrong shape and all the rest of it? You can have shape files that are already organized for you. So we don't have a place at Wellcome yet where we put all of this stuff together for researchers, but I just thought I'd highlight it for you. And this tool just came out actually this week. And it shows you all of the cohort population studies around the world. There's over 1,000 of them. Most of them don't signal that they are doing any work on climate. Yeah, and I'll leave the slides you could share if you want to find these things. But that's where I got the 4 study sites in Vietnam from. We know some of them are working on climate. Yeah, even though they don't say it actually in their abstracts. Because we fund them to work on climate, and we've been working with them to do that. It just hasn't been updated into the abstracts on the organisation. So there's numbers of tools, there's documents, etc., which we hope you will find useful. One of the challenges that investing in this space, and I very much go back to Dan's talk, and is that first of all, in the Climate Impact Award, we have encouraged all of the grantees to bring in climate expertise into the proposals from the get-go. And that's actually been quite a tough call, to be perfectly honest. It's we have a really great committee that reviews all of these proposals. And it's always been a struggle to get the kind of the right climate piece in to the health opportunity, if you like, that's presented in the call. And partly we realise there's not enough expertise that crosses climate and health from the climate side, let alone from the health side, that we actually need to build that community. We need to build the tools and the documentation and the background and all the rest of it, the whole ecosystem, to enable that to happen. And that climate services are an important part of that. Climate services are really the operationalization of climate data and climate information. And you can have a research project that produces some fabulous results. But when you leave as researchers, if there isn't an operational system that actually can keep that data flow going, it's not going to carry on. Yeah, so this was a picture from the World Health Summit where you'll see Alan, you maybe will recognize in this center right there, who's the director of the Climate Health Program, but on his right, you have the representation from the World Meteorological Organization, on his left from WHO, the World Bank, and Save the Children, etc., all thinking about the missing piece, if you like, in the climate health story, which is how do we integrate climate knowledge and expertise? And we need to do more of that. So I'm going to stop there. If you have any questions, I'm very happy to respond to them. But again, I just want to say a big thank you for you and the work that you're doing, and very much appreciate it.
Thank you, Madeline. It's really fantastic introduction. So we come to the end of the day now, and I want to take a moment to thank each of you for the time, energy, and engagement today. And your presence here has been truly invaluable, and your thoughtful contributions have enriched our discussion and reflection on this critical issue. And I would like to thank again the Wellcome Trust once again for the incredible support and for allowing us to use this beautiful office to host today's event. Thank you, Ben. You have been working alongside with Melanie and Irina along the way, and you as well. And I would also like to extend a special thanks to our keynote speakers and discussions, Dan Mitchell, Mike Parker, Fortunate Machingura, Dorothy Ngazilo, and speakers from Social Life team, Lê and Lan from Vietnam. And my heartfelt thanks also goes to Jonathan and Lo, my project team members and colleagues, for their unwavering dedication to this project since day one. And a big thank you to all our collaborators and participants who played essential roles in making today's event possible. And last but not least, I'm grateful to my colleagues at NatSen International and NatSen who have worked tirelessly behind the scenes over the past 2 months to ensure the success of this event. And I would like to thank them by name. And please join me in thanking, first, I want to mention is Melanie Wong, she's fantastic project manager in this project, and Irina Andriva, our events officer, and Katie Krab, the head of marketing and communications, and Kitty Sunaks, and Emily and Natasha from the comms team, and Socrates and Debbie Sherman, Diane, Jennifer, and Raphael from the international team, and they are all here with us today in person. And thank you very much. And today we have shared some of the early findings from our project, including insights from the systematic review, quantitative survey, and in-depth interviews. And these findings are just the beginning of our journey to better understand the health risks and adaptive capacities of precarious outdoor workers in Vietnam urban centers. And through the input and participation, it is clear how much collective will and expertise exist to tackle the challenges faced by this essential but vulnerable group. And so reflections and ideas will help us refine our work as we move forward. So looking ahead, there is much more to be done. There is a long-term effort to fill the knowledge gap, inform policies, and ultimately improve the lives of informal outdoor workers who are disproportionately affected by climate change. And we look forward to sharing further progress with you at future events and continuing this important dialogue. And finally, I encourage you all to stay connected with our project. Please visit our website, it goes live today, and where we will continue to share updates, findings, and information about upcoming activities. And I hope that many of you will also attend our end of project event sometime in late 2026. And thank you once again for being here today. And I look forward to seeing many of you again at our future events. Thank you.
Thank you so much. Goodbye.
So much. Bye. There is a lunch, or is that lunch?
Can I just note that we have a reception now in the